Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential for you. Maybe it happened just once and instantly triggered a knot of worry in your stomach. You laid there afterward, confused, wondering what just happened, feeling a rush of anxiety about what it might mean. Or perhaps it's a recurring silent issue you've been keeping to yourself, feeling a sense of shame or a quiet fear about what it might mean for your health, your masculinity, your future intimate life. You might have Googled it at 2 a.m., reading terrifying worst-case scenarios, feeling more confused and worried than before. I'm Dr. Amanda Brooks, a urologist with 12 years of experience focusing on men's vital health at every stage of life. And today, I want to have a serious but profoundly supportive conversation with you. The kind of conversation I have in my office every single week with men just like you who are experiencing this exact concern. First, and most importantly, I want you to know that I understand your concern. I see it in my practice constantly. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. It's not evidence that you're broken or failing as a man. Think of it this way. It's not a failure. It's a detailed message your body is sending you, and that message simply needs to be decoded by someone who understands the language. That's where I come in. Stay with me because in the next few minutes, we're going to explore the surprising causes behind this phenomenon, the critical warning signs you need to watch for, and most importantly, the clear, manageable solutions modern medicine offers to restore your peace of mind, confidence, and overall well-being. I'm going to explain this in plain language, without medical jargon that confuses you, and with the same compassion and directness I use with my patients every day. Understanding the normal process first. Before we dive into what happens when the fluid is absent, let's take a quick, non-textbook look at how this process should work normally. I find that understanding what's supposed to happen makes it so much easier to understand what's changed. Think of your body's reproductive system as a perfectly timed orchestra, with multiple instruments playing in precise coordination. The testicles produce the sperm. These are the string section, if you will. The seminal vesicles contribute the bulk of the nourishing, nutrient-rich fluid. This makes up about 60 to 70% of the total volume. The prostate adds a protective, slightly alkaline fluid that helps sperm survive, another 20 to 30% of the volume. This final cocktail is gathered and prepared in the urethra, the tube that runs through your penis. When climax hits, specific muscles at the base of your penis contract in a powerful, rhythmic sequence, typically 3 to 10 contractions in about 3 to 10 seconds, to propel that fluid mixture forward and out. It's a rapid event, over in seconds, but it's the result of delicate, synchronized timing between nerves, glands, and muscles that have been working together since puberty. When everything functions normally, you don't even think about it. It just happens. The critical distinction you need to understand. Now, here's a crucial distinction, gentlemen, and this is where a lot of confusion and unnecessary worry comes from. Climax and ejaculation are not the same thing. This is so important that I'm going to say it again in a different way. Climax, also called orgasm, is the neurological sensation of intense pleasure governed by your brain and nervous system. It's the waves of pleasure, the muscle contractions throughout your body, the release of dopamine and other feel-good neurotransmitters in your brain. Ejaculation is the physical act of expelling the seminal fluid from your body. It's a mechanical process involving muscles, ducts, and glands. Most of your life, from your teenage years through middle age, they happen seamlessly as one unified event, so tightly linked that you've never distinguished between them. But they are driven by separate mechanisms in your body, and one can occur without the other. Our focus today is on dry ejaculation, sometimes called anejaculation or absent ejaculation. This is the technical term for when a man reaches climax, feels that characteristic pleasure and release, but notices little to no fluid is released. It's often described to me in my office as an empty orgasm, or feeling the sensation but nothing comes out. This gap between the expected and the reality, between what you've experienced your whole adult life and what's happening now, fuels worry, anxiety, and sometimes even panic. And I get it. You've always expected a physical sign of the event. It's been part of your sexual identity. When it disappears, it can feel like something fundamental has been taken from you. But it's vital to understand this. Your ability to feel pleasure can remain completely intact, governed by your nerves and brain. The change is in the mechanical delivery system, the plumbing, if you will. This doesn't mean you've lost your virility. It doesn't mean you're less of a man. It simply means part of your body's plumbing has a specific, identifiable reason for the change. And in most cases, it's either treatable or manageable. Quick pause before we count down the main causes. If you're finding this information helpful, if you're already feeling a bit of relief just from understanding the basics, please hit that like button to tell YouTube this video matters and should be shown to more men who need it. Subscribe to join our growing community of men taking charge of their health with knowledge and support, and drop a comment below. Tell me, where in the world are you watching from? I love seeing this brotherhood of men supporting each other across continents, sharing experiences, and lifting each other up. Now, let's break down the 3 most common causes of dry ejaculation. Knowing the why is the first step to feeling in control instead of feeling helpless. Cause number 1. The gatekeeper is too relaxed. Retrograde ejaculation. The single most common cause I see in my practice is called retrograde ejaculation, and it accounts for probably 70 to 80% of dry ejaculation cases in men over 50. The biology. Picture a small muscular valve. Think of it as a gatekeeper or a door at the exit of your bladder where it meets the urethra. This valve is called the bladder neck sphincter. During climax, this valve should clamp down tightly, like a door slamming shut, ensuring the seminal fluid only has one way to go, forward and out through your penis. It's an automatic response controlled by your autonomic nervous system, the same system that controls your heartbeat and breathing. If this valve is weakened or too relaxed, it doesn't close properly during ejaculation. The seminal fluid, following the path of least resistance, flows backward into the bladder instead of forward and out. Physics dictates that fluid flows where it's easiest to go, and if the bladder door is open, that's where it goes. You still feel the full pleasure of climax. All those neurological signals are firing normally. The muscle contractions still happen. Your brain experiences orgasm exactly as it always has. But since the fluid doesn't exit your body, the ejaculation feels dry. Nothing comes out. The practical clue. A common, non-alarming clue that this is happening is noticing your urine is cloudier or milkier than usual right after intimacy. This is because the seminal fluid is now mixing with the urine in your bladder. When you urinate after sexual activity, you're essentially flushing out the ejaculate that went backward instead of forward. Some men also notice a slightly sweet or different smell to their urine afterward. This is completely harmless. It's just the presence of seminal fluid. The practical causes. This most often happens after certain surgeries on the prostate or bladder. Procedures like TURP, transurethral resection of the prostate for enlarged prostate, or surgeries for bladder issues can affect the delicate nerves controlling this valve. The surgeries are successful and necessary. They solve the problem they were designed to solve, like improving urine flow, but they can have this side effect on the ejaculatory mechanism. It's also a known side effect of specific medications used to treat conditions like high blood pressure or an enlarged prostate. Alpha blockers like tamsulosin, Flomax, doxazosin, or terazosin work by relaxing smooth muscle tissue to improve urine flow or lower blood pressure. But they also relax that bladder neck muscle, leading to retrograde ejaculation in 50 to 90% of men who take them. A story from my practice. I remember a patient, a very proud man in his early 60s, who came to me absolutely distraught after a successful prostate surgery. He thought he'd lost his manhood, as he put it. His surgery had been completely successful. His urinary symptoms were gone, his cancer was removed. But this one side effect had shattered his confidence. When I explained to him that it was purely a mechanical alteration, like a traffic light being stuck open when it should be closed, and that his desire, his ability to feel pleasure, and his capacity for erections were completely unaffected, I watched the relief wash over his face. He understood that he hadn't lost anything essential. The plumbing had just rerouted slightly. Cause number 2, the plumbing is blocked, duct obstruction. Our second major cause is an obstruction or blockage in the ducts through which the seminal fluid passes on its way out of the body. The biology. The seminal vesicles and other glands are still producing fluid normally. The factory is running fine. But think of the ejaculatory ducts as delivery pipes, like the plumbing in your house. If these pipes are blocked by scar tissue, inflammation, or other obstructions, the delivery vehicle can't pass through. The volume drastically decreases or disappears entirely, even though production upstream is completely fine. It's like having a working faucet but a clogged pipe. The water exists, it just can't get through. The practical causes. Causes for these blockages can include scarring left behind by past infections, such as a severe untreated prostatitis, inflammation of the prostate, or epididymitis, inflammation of the tube that stores sperm. Sometimes men had these infections years or even decades ago, didn't seek treatment, or didn't complete the antibiotic course, and the resulting scar tissue has now caused a blockage. Rarely, small calcifications, like tiny stones or mineral deposits, can form in the prostate or ejaculatory ducts and block the passage. These are similar to kidney stones, but much smaller. In some cases, congenital issues, problems you were born with, can cause narrowing of these ducts, though these usually present earlier in life. The practical signs. Symptoms can be subtle at first, but some men report a new, mild discomfort, pressure, or aching in the pelvis, perineum, the area between the scrotum and anus, or lower back during or after climax. This happens because the fluid is being produced but has nowhere to go, creating pressure. Others may have noticed that the fluid volume has become progressively thicker, more gel-like, and less abundant over a long period, months or years, before eventually disappearing altogether. The excellent news. Many of these obstructions can be addressed. Often we start with medication to manage inflammation and see if that opens things up. Anti-inflammatory medications or antibiotics, if there's an underlying infection, can make a significant difference. If needed, there are minimally invasive procedures like transurethral resection of the ejaculatory ducts, TURD, to restore normal flow. These are outpatient procedures with relatively quick recovery times. Cause number 3, the fuel is low, hormonal factors. The third major area to investigate is hormonal factors, specifically low testosterone, but also potentially thyroid issues or prolactin imbalances. The biology. Testosterone is the primary fuel for the male reproductive system. It's not just about sex drive or muscle mass, though it affects those too. Testosterone is crucial for the optimal function of the prostate and seminal vesicles, which contribute the bulk of the ejaculatory fluid. When testosterone levels drop significantly, a condition called hypogonadism, the entire reproductive system essentially slows down. The glands don't produce as much fluid. The machinery runs at half speed. The emotional and physical impact. Initially, you might notice a gradual reduction in fluid volume over months or years. But over time, this hormonal deficiency shows up in multiple ways. Decreased libido. You just don't think about sex as much. Less firm erections. You can still get hard, but not as reliably or as firm. And generally less intense sensations of climax. The pleasure is muted. On a broader level, men often experience fatigue that doesn't improve with rest, mood changes including irritability or depression, loss of muscle mass even when exercising, increased body fat, especially around the midsection, difficulty concentrating, and reduced motivation for activities they used to enjoy. All of these together create a picture of low testosterone. The practical solution. This is often a highly treatable condition. If a simple blood test, done in the morning when testosterone is highest, confirms the deficiency, carefully managed testosterone replacement therapy can often restore not only better fluid production, but also energy, desire, muscle mass, mood stability, and overall quality of life. Treatment can be delivered through injections, gels, patches, or pellets inserted under the skin. The key is working with a knowledgeable physician who monitors your levels and adjusts dosing appropriately. It's a mistake to just chalk this up to getting old and accept it as inevitable. Yes, testosterone declines naturally with age, about 1% per year after age 30. But symptomatic deficiency is not a normal part of aging and deserves treatment. The critical exceptions: when to worry. While most of the time these causes are manageable and not medically dangerous, as your doctor, I must also address the critical exceptions. Dry ejaculation can sometimes be a red flag for a more serious underlying condition, which is why paying attention to accompanying symptoms is crucial. When to see me or a urologist immediately. If dry ejaculation appears suddenly and without explanation, especially if it's accompanied by any of the following, do not wait. Schedule an urgent appointment. Pain during ejaculation or climax that's new or severe. Blood in the urine or seminal fluid, even a small amount. Fever or chills, which could indicate infection. A complete loss of sensation in the genital area or difficulty achieving erection that's sudden. Difficulty urinating or complete inability to urinate. Numbness or tingling in the legs, feet, or pelvic area. These are signals that require urgent urological evaluation because they could indicate conditions like certain neurological diseases like multiple sclerosis, Parkinson's disease, or spinal cord injuries that affect the nerves controlling ejaculation. Uncontrolled, long-standing diabetes causing diabetic neuropathy, nerve damage. In rare cases, specific urological cancers affecting the brain, prostate, bladder, or seminal vesicles. Severe infections like prostatitis or epididymitis that need immediate antibiotic treatment. The emotional impact is real and valid. Beyond the physical mechanics, we absolutely cannot ignore the profound emotional toll this takes on men. In my 12 years of practice, I've learned that the psychological impact is often more distressing than the physical symptom itself. Many men equate the presence and volume of seminal fluid with their performance, their virility, their very identity as men. It's deeply ingrained, culturally reinforced, and tied to self-worth. When it disappears, feelings of inadequacy, anxiety, embarrassment, and frustration can take root quickly. It's extremely common for men to start avoiding intimacy altogether out of fear of being judged by their partner, feeling incomplete, or experiencing that moment of confusion and disappointment again. Some men withdraw emotionally, become irritable or depressed, and lose interest in connection entirely. Partners often sense something is wrong, but don't know what, which creates distance and misunderstanding in the relationship. The emotional reassurance. The most important step to breaking this cycle is information and communication, exactly what we're doing right now. Understanding that this is a physiological change, not a personal failure, lifts an enormous weight off your shoulders. Your ability to feel pleasure, have erections, connect intimately with your partner, and enjoy physical and emotional closeness does not solely depend on the presence of seminal fluid. Your intimate life can and absolutely should remain a source of joy, connection, and pleasure. Orgasm without visible ejaculation is still a complete orgasm neurologically. Your partner's pleasure doesn't depend on seeing fluid. Your masculinity is not measured in milliliters. Your clear action plan to take back control. To wrap up, I want to leave you with a clear, supportive action plan, concrete steps you can take starting today to address this issue and regain your confidence. Step 1. Don't ignore it, investigate it. A sudden or progressive onset of dry ejaculation warrants a visit to a urologist like myself. Don't suffer in silence. Don't let embarrassment stop you from getting answers. A simple medical history, physical examination, and often just a blood test or urine sample are all that's needed for a clear diagnosis in most cases. We might check testosterone levels, look for signs of infection, review your medications, and possibly do an ultrasound or other imaging if needed. The conversation might feel awkward at first, but I promise you, we have these conversations every single day. There's nothing you can tell me that I haven't heard before. Step 2. Control the underlying conditions. Keep chronic conditions like diabetes, high blood pressure, and high cholesterol in rigorous check. These directly impact the vascular health and nerve function that control the entire sexual response cycle. Good blood sugar control, regular exercise, healthy eating, and medication compliance aren't just about preventing heart disease. They're about maintaining sexual function too. Step 3. Review your medications. If you're taking medications for prostate enlargement, blood pressure, depression, or other conditions, talk to your doctor about whether they might be contributing. Sometimes we can switch to alternatives that don't have this side effect or adjust dosing. Never stop medications on your own, but always ask if there are options. Step 4. Break the silence. Talk openly with your partner and your doctor. I know this feels vulnerable, but talking about what you're experiencing is genuinely liberating and paves the way for solutions. Your partner likely cares far more about your emotional presence and connection than about any physical symptom. Opening up often brings you closer together rather than driving you apart. Step 5. Seek professional support. Whether it's a medication adjustment, hormone replacement, a minor procedure, or even just counseling to address the emotional impact, professional support is your best tool for restoring confidence and function. Don't try to tough it out alone. Don't rely on internet forums or unproven supplements. Get real medical guidance from someone who knows your full health picture. In summary, your vitality isn't measured in milliliters. Gentlemen, the absence of visible ejaculation isn't the end of your intimate life or a verdict on lost masculinity. It is a signal from your body that deserves to be heard, understood, and investigated with the help of a professional like myself. Understanding the cause, whether it's mechanical like retrograde ejaculation, obstructive like duct blockage, or hormonal like low testosterone, is the first step to finding peace of mind and reclaiming your confidence. I've seen countless men in my office regain their confidence, their vitality, and their joy in living after receiving a clear diagnosis and actionable plan. Men who walked in feeling broken, walked out feeling empowered and hopeful. Your vitality, your worth, your masculinity, none of these are measured in milliliters of fluid. They're measured in your health, your well-being, your relationships, and your ability to live fully and connect deeply with the people you love. Don't let doubt, shame, or fear stop you from seeking answers. Acting in time, getting evaluated sooner rather than later, can completely transform your experience, restoring the security, pleasure, and intimate connection you deserve. Final thoughts. If you found value in this message, please share it with a friend, father, or brother who might be experiencing this silently. This information can truly change someone's perspective and maybe even save their relationship or their emotional well-being. Leave a like to help this message reach more men who need it, and subscribe to the channel, turning on notifications so you don't miss our upcoming content on men's vital health. I release new videos every week covering topics that matter to men at every stage of life. Remember, your best years can still be ahead of you. Sexual function can be maintained and even improved well into your 70s and beyond with the right support and information. Be proactive, be confident, and know that you're not alone in this. I'm Dr. Amanda Brooks, and I'll see you in the next video. Take care of yourself. You're worth it.